So here I am getting my therapy. Immunotherapy is a combination of two immunotherapy drugs. They're called monoclonal antibodies. One is Herceptin and the other is Perjeta. So both Herceptin and Perjeta are from the same family, and their generic name ends in MAB, M-A-B, which means monoclonal antibodies. So anytime you see one of your drugs that are given that ends in MAB is monoclonal antibodies therapy that has proven to be less hurtful to the patient, but very effective. It works with the cells. I will go into more details about the mechanism of that in another video. Wanted to give you a quick preview of what it's like to be in the chemo chair. Unfortunately, right now I'm covered in blankets because it's cold in here. Basically, you are sitting in your chair getting an IV for a while. I mean, the standard therapy is 30 minutes one and 30 minutes observation, and then 30 minutes for the second one. In my case, we do 45 and 45, which is something I'm comfortable with. And I know that the standard is 30-30, but I had a really bad reaction one time to Herceptin, so I believe in getting it a little slower than normal. And again, it goes back to you being an empowered patient and being informed and asking your nurses, hey, is it okay if we do 45 minutes instead of 30? Whatever you are comfortable with. Now, I'm not saying you should get 45. I'm saying that's what works for me. In the end, is what works best for you. You know, I'm just sharing here my experience. But yes, I sit here at the chemo chair every 3 weeks, and it looks like I will be doing that for a long time. On a daily basis, I do take an oral anti-cancer drug. It's Pfizer's aromacin, also known as exemestane. That's why we call it a cocktail, right? So with that, they've been able to hold it off that long, which is good. Also, you know what else is great about being here? It's also time for yourself. I tend to catch up on my email. Sometimes I take a nap. It's a nice little mini vacation. Well, not quite, but I do have a nice view. Let me share it with you. A very nice window view here. Not all hospitals offer that. Sometimes it's just 4 walls, but it is what it is, and you make the best of it. Some places offer coloring books, and talk about coloring books. I have to tell you that I have come up with coloring books. So I'll be talking some more about that also in another video. That is the scoop with the medication today and what receiving chemotherapy is like. Usually after they take the chemo, and I usually hang out in the chair for at least 10-15 minutes before going home, and I never take that bracelet off until I get home, because you never know, God forbid something happens and you get sick or something on the road. Whoever the medics, they can see where you've been and who you are right away. That's just my own personal method of staying safe after getting treatment. That's all for now. I think I'm gonna take a nap. So now I'm back in the car. Just left the clinic. I feel fine, thank God. Yeah, all good. The one thing is I get so cold, and I don't know if all of you guys, whoever is receiving chemo or immunotherapy, if you feel it too. Feel cold. Like normally my car temperature is at 67, 68, even 70 on a chillier day. But like literally right now it's at 78 degrees because it's freezing, and it's only 84 degrees outside. I mean, it feels wonderful outside. It happens every time I leave chemo. I get so cold. But look, these are minor side effects, nothing. But this is just sharing with you how it is with chemo. So it's not bad. I know that there is some chemo where you're super sensitive. It's even worse. You become super sensitive to cold weather. But this is not the one. But it happens to me every time, which I am glad I live in a warm climate like Florida. I don't think that could be for a long time a cancer patient living in a cold weather because of that. But anyway, enough said. So one very interesting tidbit. after my treatment, immunotherapy, and I would imagine this happens with chemo. I came across the street to get a bite to eat. I had a falafel, by the way. I'm trying to stick to as vegetarian as possible type of diet. Sometimes I will have a chicken or meat, but it's not my daily bread. So I had a falafel, had a wonderful, wonderful tea, and I'm not cold anymore. I had to put the temperature back to 68, 70 degrees. So that's good. So that's the trick. If you get cold after chemo, and if you can't eat, try to eat something warm. It will warm you up. It did it for me. That's it for now.